prolonged hospital stay can often bring stress, not just to the patient, but to their entire family. The network of support may not have the insight, connections, or resources to ensure the patient has everything that they need to make a speedy recovery, and that's where patient advocacy comes into play. Joining us now from the UNM Sandoval Regional Medical Center is Dorella Sandoval-Grabowski. So tell us exactly what a patient advocate does. What is that?
Well, at Sandoval Regional, as patient advocate, I have the opportunity to visit all of our new admissions, which on Monday mornings could be the entire house.
Wow.
And I just walk in, I let them know that there's a patient advocate available to them. If they need any help getting through the system, if they're having concerns of any kind, whether it be medically related or how does my daughter get my medical records,
Right.
to the nurse was mean to me today,
Right.
which can happen sometimes in the patient's perception.
Sure, sure.
And so what a patient advocate does is help the patients maneuver through the system, and we address any concerns they have, and we also, anytime that we get a compliment, I let the staff know that, you know, the patient in 405 loves you guys, keep it up.
Okay.
Because I believe that our staff needs to hear both.
You bet.
Both sides of the story.
Absolutely. So now, is this something new? Is patient advocacy kind of a new thing, or has it been around for a while?
Actually, it's been around that I know of at least 20 years.
Okay.
The patient advocate downtown at UNM Hospital, his name is Willie Barella. He has done it for 18 years.
Okay.
I had the opportunity to train with Willie for 2 weeks. If I do half the job Willie does, I'm going to be a success.
That's great. That's fantastic. Well, so what are some of the, you kind of broke down with us some of the things that patient advocates will deal with, but what are the more common elements? Is it interacting with the hospital staff? Is it interacting with billing? Because a lot of those things you can get stressed out as a patient.
Oh, sure.
And, you know, and obviously that stress cannot be good to help for a speedy recovery. So what are the more common issues that you deal with on a day-to-day basis?
I think a lot of it is just communication issues.
Okay.
Sandoval Regional, we have a young staff, and I had one patient tell me one day, your nurse is talking to me like my granddaughter texts me.
Okay.
and we look at these concerns, always look at them as a training opportunity, an education opportunity to help our staff understand how people like to be spoken with.
Right.
Our patients don't come to us at their best.
Sure.
They're stressed out already, and our job is to relieve the stress and help them understand what's happening now and what's going to happen in the future.
Right.
Sometimes it'll even call for a care management, for the care management team to have a meeting with the patient and their family and say, here's what happened when you came in, here's what's happening now, and here's what's going to happen in the future. What we want is for our patients not to be stressed so that they can heal and heal quicker.
Absolutely. So obviously one of the most important reasons that's why we would want a patient advocacy at a hospital is to make sure that stress of you know, miscommunication, uncertainty, not knowing is removed so that we can focus on our well-being.
Exactly.
Yeah,
exactly.
okay.
And that's my goal. And if we can fix their concern in the most quickest way possible, that's our goal. And the staff knows that.
Yeah.
I was kind of afraid when I trained with Willie downtown, and I said, Willie, what if they don't respond to me? And he said, Dory, they have to.
Yeah. So let me ask you just very quick before we get out, is this patient advocacy, does it start as soon as we become inpatients, or if someone watching, maybe they have a family member staying at UNM Sandoval Regional Medical, they say, we want Dory on our team, can we call and request you specifically, or how does that work?
Absolutely. Okay. I can be called at any time. I could be called even if they're stressing out because they don't, and I have had this call, I'm going to be admitted tomorrow, nobody's even called me for my insurance information. Absolutely, I can be reached. Be reached.
And do we just call the hospital number, or do we have a direct line?
My direct line is 994-7393, and so I can help. And it's not just inpatient.
Okay.
If something happens in the clinic, or during an MRI, or they don't know where to go to get their lab tests done, call me. I can give those directions.
All right, Dory, thank you so much.
You're welcome.
Again, guys, for a full recap on the patient advocacy programs with Sandoval Regional Medical Center, head over to CASA.com.